be able to listen to you. So here is your station. Right. So if you've read and understood, considering a surgical pathology station, kindly please tell me what are the differential diagnoses you'll consider for this particular patient?
Yes, ma'am. The differential diagnosis includes familial adenomatous polyposis,
Yes.
the Lynch syndrome, the Gardner syndrome, or inflammatory bowel disease, or colon cancer.
All right. Good. Okay. Can you tell me, right, how would you confirm your diagnosis?
By the colonoscopy and biopsy of the lesions.
Okay. Any other investigations you'll do to rule out all the investigations that you've asked for? So maybe you can include the blood count.
Yes, ma'am. For the start,
Yes.
we would we would do the baseline investigations that include full blood count, urea
Yes.
creatinine electrolyte,
All right.
LFTs, then coagulation profile.
All right. Okay. Thank you. Can you please tell me, right, after you've made your diagnosis, since your patient is worried that her father died in early age, so how would you like rule out this family concern of this patient?
Yes, ma'am. The first thing is to go for the colonoscopy and biopsy of the lesion to
Yes.
confirm the disease.
Yes.
And we can do the genetic testing to
Yes.
test the different genes which are involved in the colon cancers.
So what are the genes which are involved in carcinoma of the
Yes,
colon?
that is mutation in the APC genes, mutation in the KRAS genes, and mutation in the P53 genes.
All right, just suppose with investigation, it has been concluded that she is suffering from or she is having inflammatory bowel disease, and that also that she can also be suffering from the same condition. So, what are the surveillance investigations that you'll ask for this to follow up this patient for the future?
The surveillance starts at the age of 12 years,
Okay,
and
but
that
she's
needs
23. Yes.
yes, and that needs yearly colonoscopic surveillance for the progression of the lesions.
Okay, she has one large ulcer which is 7 millimeter. So how
Yes.
frequently would you ask her to come for the follow-up?
Can I come back to this question?
Yes, sure. Okay, can you please tell me what do you understand by the term proto-oncogenes?
Yes, proto-oncogenes are the normal genes that are responsible for the normal growth of the cells with the intrinsic regulation and with the checkpoints. And these are not mutated genes; these are normal genes.
Okay, can you tell me how would you define the term adenomas?
Yes, adenomas are defined as the growth of the mucosa in the colonic epithelium, and they are connected to the epithelium with a stalk.
Okay, can you give me some examples of different types of adenomas?
Yes, that includes neoplastic adenomas, non-neoplastic adenomas, or inflammatory adenomas. In neoplastic, there would be tubular and tubular-villous or villous adenomas. And in neoplastic, there would be hematomatous lesions. And there will be inflammatory that includes pseudopolyps and hematomas.
Can you tell me what you understand by the term ulcerative colitis?
Yes, ulcerative colitis is the type of inflammatory bowel disease that includes ulcerated lesions in the colon, and it's a superficial inflammation.
Considering the family history of the patient, what management can you offer her?
Yes, it starts with the conservative management that includes the low residue diets, and the medical management of the ulcerative colitis includes the antibiotics, the steroids, 5-aminosalicylic acids or immunomodulators. And if that is refractory to the medical management, then there is the option of surgery in the cases of complicated states.
She has strong family history. So you had to, and you
So
had to
yes,
bring
yes, yes,
from here
yes.
because okay, we'll discuss that later. Can you please, right, can you please
The
tell me how would you classify the colon carcinoma?
uh, on the basis of Duke's classification.
All right, okay, or TNM. You are telling me. So if you will take Duke's classification, what is it? And explain it, please.
Uh, can I come back to this one later?
All right. Okay, can you name few extracolonic FAP
Yes,
uh, lesions? Familial
yes, it includes
adenoma.
yes, it includes the Gardner syndrome. That includes the skull osteomas, desmoid tumors, mandibular osteomas, and along with the familial adenomatous polyposis. And the extraintestinal manifestations include aphthous ulcers, pyoderma gangrenosum, iritis, rhythm noduosum,
This patient
and
is a
other
known
factors.
case of endometriosis. Can you explain the term, please?
Yes, endometriosis is defined as the presence of ectopic endometrium uh, uh, outside the uterus.
So, would you be able to explain why patients suffering from endometriosis suffer with pain?
Yes, because of the recurrent inflammation during the menstrual phase, and that leads to the fibrosis of the lesions that causes the pain.
Can you please help me and define or describe this image?
Yes, this is the colonoscopic image that shows multiple variable size polyps and along with the ulcerated lesions in the lumen.
And can you comment on the glistenings? And what is this? What is this? Can you mention anything else? All right, we can come back to that later. Right. What lifestyle changes would you suggest to this patient
Yes,
after
I would
looking at the colonoscopy of this patient, this particular patient?
yes, I would advise her for the high fiber diet, the diet rich in the fruits and vegetables, and uh, decrease amount of meat and smoked meat. I would advise her for the abstinence from the smoking and alcohol and
Okay.
regular surveillance
Yes, and
of
reduce fat intake as well.
reduce
Okay.
fat intake. Yes.
Can you, because you said there are multiple ulcers, can you define the term ulcer? Did I ask you this question before?
No, ma'am.
Okay,
Ulcer is
please.
defined. Ulcer is defined as break in the continuity of the skin or the mucous membrane due to discoamation and disintegration of the necrotic membranes.
Okay, good. Right. If we can ask, all right, what is P53 gene or tumor suppressor gene? What are the
Yes,
tumor suppressor genes?
yes, it includes the APC genes and the P53 genes.
Yes.
P53 is a tumor suppressor gene. It works whenever there is a DNA damage. It works in a three-way. It will repair the gene. It will repair the DNA. It will lead to growth arrest, and it will lead to apoptosis.
All right. Can you tell me which type of colon carcinoma is, yes, which kind of colon carcinoma is most or has the highest chances of malignancy or yeah, or to
Yes,
ask?
it's the villus adenomas that has
Yes.
the highest malignant potential.
Well, yes, good. Thank you.
Can we come to the skip questions?
Yes.